Hi, I'm Sarah Parks, and I will be teaching the Encore Estate Planning class this fall. I've been doing estate planning for 25 years and have seen many issues in clients who have come to me for help. I enjoy being an estate planner because I can use my knowledge and experience to bring peace into the lives of the families I work with. Estate planning is what we can do to make our wishes known to our families and friends in our and in their most vulnerable times. The two most vulnerable times I can think of in anyone's lifetime are when we are incapacitated, either permanently or temporarily, and when we die, including all of the events that happen around a death. Having our wishes written out in a legally viable way means that during those times our loved ones know what we want and do not have to argue over what to do. In short, estate planning is primarily done to reduce or eliminate conflict in potential areas of conflict. Potential areas of conflict are issues such as who makes medical decisions for an incapacitated person. Does the incapacitated person want to be kept alive on life support at the end of life? And does the incapacitated person want to be an organ donor? Giving our loved ones our own guidance on these issues means that there's less potential conflict at a time when emotions tend to run high and a perceived slight can cause dissension for years. Because incapacity is fraught with potential conflicts, medical directives are an important part of a comprehensive estate plan. These documents allow us to make our wishes known, both to our loved ones and to our medical providers, doing what we can to maintain as much control over our physical bodies as possible. Estate planning also allows us to provide legal direction as to what happens to our personal property and our estates at our death. As with other estate planning issues, having our instructions written in a legally effective way can vastly reduce conflict over the distribution of an estate. My goal in teaching the estate planning class is to allow students to understand enough about estate planning issues and the options they may have around whatever issues arise in their own lives that they are able to make good decisions about their own estate planning, whether done in normal times or during a pandemic. If you're interested in learning about estate planning, I will look forward to meeting you.
Good morning. As you interact with this Zoom video, your brain is working in multiple ways on several levels. You're seeing my face and the surrounding images largely through the effort of the posterior half of your brain, while the sides of your brain allow you to perceive the sounds coming out of my mouth as coherent English speech, or so I hope. At a level less likely aware to you and engaging the front and also older parts of your brain, you may be asking yourself, will I be able to tolerate 4 90-minute sessions of this face and voice? Is this guy likely to know what he's talking about? And maybe most important, do I want to spend my hard-earned income or IRA dollars to learn what he has to share? And if that weren't enough going on, you may also be sipping coffee or a Bloody Mary, depending on the time of day or how COVID-19 isolation is going for you, while adjusting the waistband of your sweatpants. But without a doubt, your brain has been active and aging since you signed on to this video. I'm Mike Stutts, and I'll be teaching the course Aging in the Brain in the coming fall. Our brains are unquestionably our most complex organs, and we of the Encore Learning age cohort are probably more concerned than younger generations about how our brains are doing and what lies ahead as we age. My teaching objectives for this course are to provide not only an appreciation of the brain's complexity, but a general understanding of how it works for us. I will overview the aging process in general, with particular emphasis on its impact on the brain. We will learn the brain disorders that are more prevalent in older age, such as mild cognitive impairment and Alzheimer's disease, but mainly to more clearly distinguish them from normal aging behaviors. Finally, and here's the good news, we will learn to keep our brains healthier as we age. My credentials and experience are conveyed in the course guide, so I'll not repeat them here. However, in my 33-year academic career at Eastern Virginia Medical School, the type of teaching at which I most excelled was the seminar format, less purely didactic and more interactive. I still hope to bring elements of that into this course, even though our time together will be virtual rather than face-to-face, as would have been the case in the aborted spring semester. I will have 2 able virtual classroom aides to assist this process, and I myself will receive additional Zoom training. So I'm confident that together we can pull this off to provide an informative and stimulating experience. I look forward to seeing you, if only on my Mac screen, come October.
I'm Dwight Rodgers, the instructor for Basics of Mindfulness Practice, beginning November 2nd, which is a Monday. The class will last from noon to 1:30 and has 6 sessions. I'd like to introduce my associate instructor who will be there from time to time. The class has 6 weeks. The first week we'll be talking about the value of mindfulness practice. In the mindfulness tradition, the first observation is that life has unsatisfactory aspects which result in distress, pain, anxiety, fear, what we generally call negative emotions. The fundamental activity of mindfulness is to recognize what is in the moment, from the pain and the need to a reaction to a traumatic event, and developing a different and changed relationship with what you observe. Some call this new perspective the observer self, which is an outlook which centers in the present moment, setting aside your attachment to the past and your speculation about the future, and seeks to understand your wants and don't want, sometimes called your cravings and aversions, or in a word, a summary word, your reactions to whatever is coming to mind or what you are feeling. Many people use mindfulness meditation as simply a gateway for relaxation or for falling asleep, but others use the practice to go much deeper, to explore the persistent distresses of life, both physical and emotional. So we'll cover that in the first week. And then the second week, we'll talk about specifically meditation as a tool to get into mindfulness practice. The third week, we'll talk about the roots of mindfulness practice, which is the history going back about 2,500 years. And then the fourth week, we'll turn to mindfulness practice in the modern West as it developed in the 20th and 21st centuries. The fifth week, we'll talk about resources that are available to you in person and online, many of them at no cost or with a simple contribution. And then in the final week, we'll talk about continuing and developing mindfulness practice. Mindfulness practice is not something you learn and then drop after 6 weeks and take off the shelf, but it's something that you need to persist in practice in order to be to realize the real benefits of it. I'm recommending a book by a woman named Tessa Watt for the class, W-A-T-T. It's called Introducing Mindfulness, a Practical Guide. It's available from Amazon and Barnes & Noble for a very modest cost. And finally, we do have in Encore Learning a mindfulness club, which meets weekly on Wednesday at noon, currently virtually. If you're interested in getting on a mailing list for the club, please contact the Encore Learning office. I hope to see you in November. Thank you.
Good morning, ladies and gentlemen. In the past 5 or 6 years, geology, ocean science, atmospheric science, and biology underwent a revolutionary change due to the significant increase of instrument and sensor sensitivities, both terrestrial and in space. This course is aimed at explaining the basic concepts of the sciences and the breakthrough results that sometimes greatly improved our understanding and sometimes completely changed what we thought we knew of the globe. Just a few examples. Now we know in great detail how the Antarctic continent looks without ice, how the North American continent had formed, and many other breakthrough knowledge. Did you know that there is an entire continent below Europe? Its name is Greater Area. Did you know that there is an all-out war between the Earth's mantle and its crust that we are living on. Did you know that human activities even impacted the wobble of the Earth? Did you know how much human activities impacted the weather and plastic pollution of the oceans that will soon equal the entire biomass of all marine life in the oceans? What will happen in the next 20 years if we do not do anything with emissions and ocean pollution? How much will it cost to slow down or stop the climate change? How good are the models we use to predict temperature, weather changes, and ocean levels? And finally, will the human race be near extinct 100 years from now? If you are interested in the answers, please take the course number 6008, Geology, Oceanography, and Evolution, beginning October 27, 2000.
Hi, everybody. I'm Pam Hines, and this is the description of my course, which we're calling Biological Sciences, the Latest News. The course will meet noon on Wednesdays beginning September 30th. Now, when I signed up to do this, of course, that was before the COVID pandemic hit, and now we're doing it online. I think it's going to be great. I think we'll have some great discussion in this class. It's a small group class in order for us to be better able to get discussion going about some of the latest headlines in biological sciences. I will start with, we'll start by talking a little bit about COVID-19, but I don't want to spend the whole time on that because I think perhaps you've heard a tremendous amount about it already. The first week we'll have a little focus on COVID-19 from probably a slightly different angle than you're generally hearing from the news. And we'll go on. First, let me tell you a little bit about myself. I am a senior editor at Science Magazine. That is this publication. Science Magazine is read by over 1 million people each week. It comes out every week, and it is a tremendously interesting magazine that at least I think so, and I hope that you enjoy looking at it too. There are two main components to science. In the back portion, we have the primary research articles. This is the dense reading that I think that we might be able to get through a little bit of. In the front portion is more news type articles that are easier to access, a little less technical, but still provide some tremendously interesting talking points. So we're going to look at some of the primary research. We'll look at some of the secondary literature, these news stories and write-ups and podcasts that talk about the research. We'll also talk a little bit about how scientific research makes its way through the publication process, from the research lab to the printed journal. We'll also talk about writing, science writing, the different purposes for science writing, how writing for different audiences needs to communicate in a slightly different way. And I hope that I can get you all to do a little bit of science writing. If we want to, if everybody wants to, we can post those bits of science writing on a blog, on an internet blog. I hope that you will join me, and I'm looking forward to some lively discussions as we get to know each other. Thank you.
Hello, all fellow Encore Learning members. I'm Steve Shapiro, and together with my colleague Charlie Hallahan, we're going to be offering Numbers and News again this year. This is our 4th season. Last year's course sold out really quickly, and we had a waiting list, so we've agreed to expand the class size. We've also lengthened the course to 10 weeks this year so we can fit in all the topics we hope to cover. We also hope to retain some of the class participation that made the class more interesting. We are scheduled to meet on Thursdays at 10 a.m. The course explores the intersection of journalism and data analysis. And this year, we are also going to be introducing for the first time a discussion of the cognitive biases that impact how we interpret the news and make decisions in our lives. As in past years, we're going to be updating the course each fall to include current news topics. So we're going to be spending quite a bit of time talking about the COVID-19 pandemic, including various types of forecasting models. We'll explain the terminology that's emerged to talk about fatality rates, contagion, infection and antibody testing, and the impact on our healthcare system. And we'll discuss some of the cognitive biases that affect social distancing, the use of face masks, and other choices we've all had to make. As in past years, we'll be covering the upcoming election with an emphasis on the presidential race, the Senate races, and a variety of surveys that illustrate partisanship. We'll also discuss some of the new types of polling methods that have become more common. We'll start with a brief analysis of journalism and some basic statistical concepts, and then we'll be moving into the COVID-19 and politics session. After that, we'll be discussing demographic changes, climate change, state of the economy, and gun violence. The course is not a college statistics class, so no prior knowledge of quantitative analysis is required. But we hope to demystify some of the metrics that have been used by journalists to explain complex topics to a general audience. This includes a discussion of risk versus uncertainty, skewed distributions, misleading graphics, and some basic statistical metrics.
Stories on COVID testing have been much in the news lately. Such tests may produce false positives or false negatives. We will discuss the factors involved in these outcomes, including the role played by Bayes' theorem on probabilities. We will discuss the differences between randomized controlled trials and observational studies, and why the former are much preferred in the medical field. Finally, the topic of big data, claims of quote-unquote statistical significance in studies, and several studies reported in the popular media, such as "Are coffee or eggs good for you? Should you take an aspirin each day?" etc., etc. We have many issues to cover and look forward to seeing you in the course.